Gamete intrafallopian transfer, also known as GIFT, is used for infertile women who are ovulating but have blocked oviducts or fallopian tube. Gamete intrafallopian transfer uses multiple eggs collected from the ovaries. The eggs are placed into a thin flexible tube, or known as catheter, along with the sperm to be used. The gametes, both eggs and sperm, are then injected into the fallopian tube using a surgical procedure called laparoscopy.
Making a baby isn't always easy. Fortunately, there are many ways to parenthood. In vitro fertilization, or IVF, brings the miracle of conception into a laboratory. It has led to the birth of nearly 10 million babies since the first successful fertilization procedure in 1978. So how does it work? Let's take a closer, step-by-step look at the process. Step 1. Preparation. The IVF treatment process begins long before any egg removal and fertilization takes place. You'll need a thorough medical history before treatment begins, plus fertility tests and analysis for you and your partner. As the procedure gets closer, you may be prescribed birth control pills or estrogen to control the timing of your menstrual cycle and maximize the number of mature eggs available for retrieval. Step 2. Ovarian stimulation. During a typical ovarian cycle, only one egg becomes mature enough to ovulate. IVF treatment uses injectable hormone medication to bring a group of eggs to maturity to increase the odds of a successful pregnancy. The type, dosage, and frequency of the medication will be tailored specifically to you for optimal results. Monitoring of the eggs may occur daily or every few days during this time to determine when they mature. A final trigger shot is given exactly 36 hours before the scheduled egg retrieval to finalize the maturation process. Step 3. Egg retrieval. Once the eggs are mature, it's time for egg retrieval. During this step, a suction device connected to a long, thin needle is inserted through your vagina. This will puncture ovarian follicles and pull the mature eggs out. Removed eggs are placed in a petri dish containing a special solution and then placed in an incubator for a short period of time. Since this procedure is mildly invasive, medication and sedation are used. Step 4. Fertilization. Fertilization of the eggs takes place within a day. During a procedure known as an intracytoplasmic sperm injection, or ISCI, a single sperm is introduced into each mature egg. On average, about 70% of mature eggs will successfully fertilize. Step 5. Embryo development. Now comes the growing and waiting. Fertilized eggs are monitored and left to develop over the next several days, with cells actively dividing. About half of fertilized embryos will progress to the blastocyst stage when they are suitable for transfer into a uterus. Embryos that are suitable for transfer can either be used right away or frozen for future transfer. Step 6. Embryo transfer. Within a week after fertilization, it's time to transfer the embryos. This is a short procedure that only takes about 10 minutes and feels very similar to a pelvic exam or a pap smear. A speculum is placed within the vagina, and a thin catheter is inserted through the cervix into the uterus. An embryo or embryos are then injected through the catheter into the uterus. After an embryo transfer, you may experience symptoms such as mild bloating and cramping, breast tenderness from high estrogen levels, spotting, and constipation. Step 7. Pregnancy. Within 14 days after the embryo transfer, a blood test will be done to determine if you're pregnant. If the pregnancy test is positive, you begin the journey of prenatal care. Pregnancy success rates per embryo transfer vary depending on the age of the woman at the time of egg retrieval. If the pregnancy test is negative, you can try another embryo transfer if you have additional embryos frozen from the first IVF cycle. If you do not have remaining embryos, you can try IVF again. IVF has been used successfully for more than 4 decades. Talk openly with your healthcare provider about your options.
Zygote intrafallopian transfer or GIFT involve oocyte retrieval by the transvaginal ultrasound-guided aspiration, followed by culture and insemination of the oocyte in laboratory within 24 hours. The fertilized eggs are transferred by laparoscopic technique into the end of waiting fallopian to the tube. ZIF different from GIF, and the fertilization takes place outside the body, allowing healthcare provider to be certain that fertilization has occurred before the growing structure is reintroduced. As in a GIF, a woman must have a functioning fallopian tube for technique to be successful, because the zygote are implanted into embryonted end of the tube rather than into the uterus. This technique allows for genetic analysis the same as IVF. The technique invited fertilization or IVF removed several eggs from the ovary to fertilization to the laboratory. After a few days, 1 or 2 in this fertilized egg return into the uterus and they form in a plant to become a pregnancy. Women having a IVF as special reproductive hormones to encourage several eggs develop into the ovaries. Final matination is the egg cell is the use of administration for nurse's hormone. Within 36 hours later, fluid contained the egg is drawn into the ovary with the needle. This usually performed at the light sedation in short outpatient procedure in the use of ultrasound to check the proceeding. And the egg collect from the ovaries, mixed from the sample of the male sperm, and already contracted the egg sperm are left in incubator and settled in 36 degrees in 24 hours so that fertilization can take place. During this time, only one of many sperm cells is prenatinated outer layer of the egg cell and form fertilization. The following fertilization separated form into the embryo. After 2 to 3 days, the healthy embryo will compromise around the egg cell to the transfer into the uterus form implant to become a pregnancy.
Surrogate embryo transfer. Surrogate embryo transfer is an assisted reproductive technique for a woman who does not ovulate. The process involves use of an oocyte that has been donated by a friend, relative, or provided by an anonymous donor.
The menstrual cycles of the donor and recipient are synchronized by administration of gonadotropic hormones at the time of ovulation. The donor's ovum is removed by a transvaginal ultrasound-guided procedure. The oocyte is then fertilized in the laboratory by the recipient woman's male partner's sperm or donor's sperm and placed in the recipient woman's uterus by embryonic transfer.
An embryo can be transferred back into the uterus. After 2 to 6 days of culturing in an incubator, a very thin, flexible plastic catheter is inserted through your cervix. And with the help of a small syringe, the embryo is injected into the uterus. If the embryo implants in the uterine wall, It will release a chemical signaling the pregnancy.
Preimplantation genetic diagnosis, the individual retrieval of oocytes and their fertilization under laboratory conditions have led to close infection and recognition of differences in sperm and oocyte. The preimplantation genetic diagnosis is an early form of prenatal diagnosis in which embryos created in vitro are analyzed for well-defined genetic defects. Preimplantation is a technique that enables couples with a particular inherited condition in their family to avoid passing it on to their children. In preimplantation genetic diagnosis, we have the techniques are used mainly in two broad indication groups. The first groups are individuals at high risk of having a child with a genetic disease. The second groups are those being treated with in vitro fertilization who might have a low genetic risk but whose embryos are screened for chromosomes aneuploidized to enhance their chance of ongoing pregnancy. In preimplantation genetic diagnosis, we have IVF and GIFT. The in vitro fertilization or IVF, a medical procedure whereby an egg is fertilized by a sperm in a test tube or elsewhere outside the body. The GIFT are modified version of in vitro fertilization. After the oocytes are fertilized in IVF and GIFT procedure, the DNA of both sperm and oocyte can be examined for specific genetic abnormalities or specific genes such as Down syndromes or hemophilia. So we have 8 typical treatment cycle for preimplantation genetic diagnosis. Number 1 is stimulation of the ovaries. In order to create embryos for genetic testing, the ovaries have to be artificially stimulated using hormones to produce several eggs at the same time. The number 2 is collection of egg from the ovaries. At the appropriate time, the eggs are removed during a surgical procedure known as egg retrieval. Once the eggs are removed, they are inspected to determine which are mature and normal appearing. The number 3 is insemination or injections of sperm. Fertilization during PGD will be done either in IVF or in ICSI. In IVF, sperm and eggs are placed together in a culture dish to allow fertilization to occur. While in ICSI, a single sperm is injected in the center of an egg. This technique is used for condition caused by a single faulty gene. The number 4 is fertilization. The morning after insemination or injection of the sperm, the embryologist carefully examine each egg to see if fertilization has occurred. Number 5 is embryo biopsy. The eggs that were successfully fertilized are grown in the laboratory for 5 to 6 days. When the embryo forms, that is called a blastocyst of about 100 to 150 cells. Number 6. Embryo testing. The cells are tested to see if the embryo from which they were removed contains the abnormality that cause the genetic conditions. Number 7. Embryo transfer. Only those embryos that do not have the specific genetic condition that was tested for will be transplanted into the woman's uterus. And the number 8 is the pregnancy test. 12 days after the embryo transfer, the woman is given a pregnancy test. A positive pregnancy test means that an embryo has implanted.
A surrogate mother is a woman who agrees to carry a pregnancy to term for a subfertile couple.
The surrogate may provide the ova and be impregnated by the man's sperm. In other instances, the ova and sperm both may be donated by the subfertile couple or donor ova and sperm. Surrogate mothers are often friends or family members who assume the role out of friendship or compassion, or they can be referred to the couple through an agency or attorney and receive monetary reimbursement for their expenses. The subfertile couple can enjoy the pregnancy as they watch it progress in the surrogate. Surrogacy process occurs in 4 steps. 1. Finding surrogate mother. 2. Signing surrogacy contracts. 3. Fertilization and pregnancy. And last, claiming parentage after childbirth.
Child-free living is an alternative lifestyle available to both fertile and subfertile couples. For many subfertile couples have been through the recourse and frustrations of subfertility testing and unsuccessful treatment regimens. Child-free living may emerge as the option they finally wish to pursue. A couple in the midst of fertility testing may begin to re-examine their motives for pursuing pregnancy, and may decide that pregnancy and parenting are not worth the emotional or financial cost of future treatment. They may decide that the additional stress of going through an adoption is not for them, or they may simply decide that children are not for them to complete their family unit. For these couples, child-free living is a positive choice. Child-free living can be fulfilling as having children because it allows a couple more time to help other people and can contribute to society through personal accomplishments. It has advantages for a couple in that it allows time for both members to pursue careers. They can travel more or have more time to pursue hobbies or continue their education. If couples still wishes to include children in their lives, in some way, many opportunities are available to do this through family connections, through volunteer organizations, or through local schools and town recreational programs.